So say somebody comes to you for preconception care and they're like, I really want to make sure my methylation's on the money so that this sort of stuff that you've been explaining doesn't happen. What are some things that they could be doing to ensure? Was there like blood tests and then supplementation and some of the things that we've been talking about earlier? What would your advice be?
Definitely have a look at some blood tests because you can check methylation patterning for people, and you can look at neurotransmitter effectiveness if it's someone that is significantly indicated. And then you do testing around all the nutrients that are cofactors for the methylation pathway. So all the folates, all the B12, magnesium, zinc, B2, B3, things like that. And you do the testing of all those nutrients, get them in the right range, supplement where indicated, but you look at that methylation patterning and then you make sure that it's addressed. There's merit to doing the nutrigenomics, which is looking at the nutritional genetic components. The challenge with doing nutrigenomic testing is that you don't know if those genes are on or off. So having them in tandem, I like, but having them in isolation, I think is risky. So if you just have genetic information, you don't know if that's actually active or not.
Mm.
But having it in tandem means you could theoretically go, well, I can make predictive estimations around methylation movement through the pregnancy.
So this kind of ties into epigenetics, right? You can get a whole set of genetic tests and it can say X, Y, Z, but you don't have any way of knowing if those genes are being expressed depending on what the environment is. So I guess that's the distinction that people need to understand.
Yeah, and I mean, a number of years ago, everyone went a bit crazy over MTHFR. And MTHFR is this tiny little one gene in the whole methylation pathway. And then they all started making prescriptions around folate based on that and which type of folate and dose of folate and all this sort of stuff. You can't do that. That's not actually methylation. That's looking at one gene that you don't even know if that gene is active or inactive. So
Mm.
important to go a little bit deeper to get a better sense. And definitely don't test your woman during pregnancy for methylation because it will be changing based on all those windows that I mentioned. But it's more that, get a sense preconceptually so you can address it.
So how soon before pregnancy would you recommend doing those sorts of investigations?
At least 4 months.
At least 4 months, and ideally?
Well, if you look at the oocyte research, ideally it's a year, but I don't know that people want to give you a year for preconception. So 4 months is then you'll at least be able to remedy the folate and B12 pathways, but 6 would be great. Some people it's pretty glitchy.